Hello, welcome to any community. Today we are going to solve one particular puzzle. In this particular puzzle, the case scenario goes like this: 40-year-old female patient having the occupation of clerk, where her home is 2 kilometers from her office. She is actually presented with the gradual onset of pain in the right knee joint since 3 months, non-radiating, severe, persistent, which is associated with the swelling in the same joint since 2 months. The question is, which particular Sannikrishta Hetu is afflicted in this occasion? Pause the video, think about it, and answer. So, when you think about this, the history is like that. In that particular situation, we are going to identify the three different the possible nidana as such in this particular occasion. Whether this particular excessive walking of 2 kilometers up and down nearly around 4 kilometers per day, whether is it responsible for that particular joint pain? Is it, or do you mean to say that it is the vata dosha or kapha dosha is affected? That is considered to be a sannikrishta hetu, or whether it is vata or kapha vitiating diet. For example, if the person is taking the katurasa sevana, so that is responsible for the vata prakopa. And if that particular lady is consuming more amount of the dahi along with mixed with the sugar, that is lassi, there may be a possibility of a kapha dosha prakopa. Whether that particular vata or kapha dosha prakopa is responsible for the what do you say that the dosha or the disease manifestation in this. So Sannikrishna Hetu means what? Whether any one of these or all the three. Definitely it is not all the three. So that means when you think about it, now the arises whether is it what is the one? Is it the first one that is walking from her home to the office to and fro? That means 2 kilometers walking up and down, nearly around 4 kilometers per day. Whether is it responsible for the disease manifestation that is considered as Sannikrishta Hetu? So the definition goes the one which is considered to be nearest cause to the human body. When you think about this, the walking from her home to the office, that is considered to be a nidana, which is considered to be present not nearer to the body as such. When you think about vata or kapha vitiating diet, that is also not nearer to the patient's body. That one which is nearer to the patient's body is the vata dosha or kapha dosha. So in this particular occasion, whether is it vata dosha is responsible for the uh, dosha vitiation, that is the disease manifestation, or kapha dosha vitiation? The answer is vata as well as kapha dosha is responsible for the disease manifestation in this particular case, that is the Sannikrishta Hetu. So when you think about the clinical presentation, it is the pain is being present that is being considered to be because of the vata dosha vitiation, and the person is having the aggravation, that is the presence of the swelling, that is indicative of a kapha dosha vitiation. What are the key takeaways from today's discussion? Mention in the comment box below. And what is the one video that you'd like to hear in the coming days in this particular channel? Mention in the comment box below and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.